I'm Michele Demusis, and we are internal medicine at Towson in the O'Day building. And we are a primary care practice here, myself, 3 other physicians, and our nurse practitioner. And we do primary care for adults. We see males, females, basically ages 16 and 18 all the way up. I'm a general internist, which means we sort of see it all, but my particular practice interest is in women's health. It's just something that I've gotten involved in over the last 20 or so years that I've been practicing. So I see a lot of people that have concerns about menopause, about osteoporosis, preventive cardiovascular health for women, that kind of thing, some office gynecology. Many times in medicine there's not one right way to do things. There are a number of ways to do things, and so I see my job as telling patients, helping them to make what I think is the best medical decision, but in a way that is comfortable for them. Some people are very test avid and they want a lot of certainty, and other people are more conservative and they want to take things a little more slowly. And I think what I like is a patient who wants to be engaged in that process, so that we can help guide them to a decision that's not only a medically good decision, but a personally comfortable decision. And that's what I try to do, especially with the patients as I get to know them better. Sometimes we set the wheels in motion and we'll know that a patient needs a procedure that we do not provide, or sometimes we'll be able to say, I know this lies within the domain of neurology or rheumatology, but I haven't seen anything like this before. You need to talk to someone who does this all day, who may have seen your particular situation. So it's very important to have access to good specialists. And I've actually been really pleased with what we found here. I think some of the medical specialty groups are very strong, and what's really been nice is they're really accessible. They've been very good about getting patients in, about communicating with us. But I've been very pleased with what we have on campus, and it makes my job easier to be able to refer to the cardiology or the GI or the pulmonary people here, for example. At the end of the day, I want a patient who leaves here to feel informed, to understand what I think is going on and what approaches we may need to take. I would also like patients to leave here with a sense of a partnership, because there are certain things that I can do. I can advise them, I can tell them what I think is appropriate, but there are a lot of things that patients need to do. They need to take their medicines, go to their visits, get their labs. A lot of times they need to make lifestyle changes. One of my old mentors said being an internist is also a little bit like being a life coach, and so I would like people to feel not only that they know what's going on, but that then they have a strategy for the part of their healthcare that they need to take responsibility for, that they can address.